Vancouver Capilano.
Thank you, Mr. Speaker. Well, apparently what the minister is describing is just simply not working. Nurses are speaking out against this about this crisis happening under this NDP government. Adrienne Gear of the BC Nurses Union is here in the gallery today. She says, quote, "One thing that we want the Premier to know is that nurses are exhausted. We are burnt out. We need you to step up and do something. We are done asking. We need you to listen, and we need you to take full action to help us," end quote. So my question is, will the Premier speak to the nurses in the gallery and across the province and tell them what he is going to do to step up and do something?
Minister of Health.
Honourable Speaker, we did and have described, and by the way, when we announced 604 new nursing spaces in BC, we were there with the BC Nurses Union. When we announced changes for internationally educated nurses, we were there with the BC Nurses Union. We're working with the BC Nurses Union every day, and they do an exceptional work representing nurses in our province. So, of course, I'll be meeting today with representatives of the BC Nurses Union as we continue to work together to address what has been an extraordinary period in healthcare in BC. I think British Columbians can be proud of our public healthcare system, proud of how it's responded to COVID-19, proud of the work of health professionals and healthcare workers dealing with the other public health emergency, the overdose crisis, proud that we're no longer substandard in 85% of care homes in terms of staffing, proud that we no longer lay off women workers, but we give them rights in the workplace, proud that we've added 600,600 workers in that sector through HCAP and other programs. But we clearly need to do more. I meet with nurses on a regular basis. I hear from them. I hear their concerns about the quality of work, about the pressures of violence in the workplace, about the challenges they face, and we're going to continue to work with them to address those issues so that we don't just recruit more new nurses, but that we, of course, every day support the ones that are working in BC.
Member for West Vancouver Capilano, supplemental.
Thank you, Mr. Speaker. The minister's pride is not enough to make change. This crisis is hurting nurses and it's hurting patients. 82% of nurses say their mental health is suffering. 74% report that patient care has been compromised. This is what one nurse says, and I quote, "I haven't worked days or evenings for over 2 months without being short-staffed. This is a crisis. We are all getting burnt out and corners are being cut. It's unsafe," end quote. So will the Premier get up and tell nurses here today what he is going to do to take action to fix this crisis?
Minister of Health.
Well, Honourable Speaker, at every level, we're investing in our healthcare system. I described specific actions that were taken in consultation with the BC Nurses Union, and I know that one tends to ask the question regardless of what the answer is. But really, those are specific responses now and in the future to support nurses, and we have to continue to do so. That means getting nurses the best facilities. That's why there's 16 major health capital projects. It means in long-term care, ensuring that residents and nurses have the support they need to deliver the care that must be given in long-term care. That means increasing community nursing, which changed dramatically as a result of the pandemic, but also increased in terms of visits dramatically in 2018 and 2019 and 20. And of course in acute care, where we feel the problems and nurses feel the problems that the member describes so passionately and so personally. We need to continue to take steps to both ensure that we have the staffing we need in our acute care hospitals and the supports we need for the staff that are working in those hospitals today.